As many of you guys discovered when we looked at the case studies, we find out a lot about the way the brain works by looking at circumstances when it fails. Looking at breakdowns of the brain is one of the ways we figure out how things function or should function. So when we think about sleep, we often pay a lot of attention to disorders of sleep to understand what's going on. So the first things we're going to look at are disruptions of sleep, such as insomnias, and then some physiological sleep-related disorders. We're going to look at a few hypersomnias, which is an inability to regulate sleep. And then lastly, we're going to look at parasomnias, which are a set of fascinating disorders that occur during non-REM and REM sleep and really highlight the differences between them. So insomnias are the most common form of sleep-related disorders. This is difficulty initiating sleep, maintaining sleep, and awakening in the mornings, right? So even if you can fall asleep and stay asleep, if you report feeling non-restorative, that your sleep was not restful, you struggle to wake up in the mornings, you may be dealing with a form of insomnia. In order for it to be diagnosed, it should be occurring 3 to 4 times per week and should persist more than a month. This should also be occurring with adequate ability and circumstances to fall asleep, right? If you're not sleeping because your job or other issues are preventing you from sleeping, but you could sleep if you were able, that's not insomnia. That's lifestyle and life quality issues that have to be addressed. There are 2 main types of insomnias. The first is what we call primary insomnias, which are due to some sort of neurochemical, psychological dysfunction. The most common type is what we call adjustment insomnia, which is more commonly referred to as jet lag. When you have traveled to a new place that's on a different timetable than you are, and you struggle to adjust to that, and so when everybody else is asleep, you're struggling to fall asleep because your circadian clock is telling you it's not time to sleep. Adjustment insomnias can often be addressed through consistent sleeping patterns and habits and exposure to light during the waking hours. So as most people who travel have experienced, right, it can take a few days or even a few weeks to fully adjust to a different time zone. But if you consistently go to sleep and wake up at the same time, and if you expose yourself to plenty of sunlight during waking hours, adjustment insomnia usually self-corrects. Psychophysiological insomnias are often related to psychological issues, stress, anxiety, worry, and oftentimes then manifests in a particularly insidious form of worrying about not sleeping. So your anxieties are keeping you awake, but then you get anxious about not sleeping, and so now you're freaking out about not sleeping because you're too anxious to go to sleep, and you're anxious about not sleeping, and it turns into a vicious cycle that can make it very, very hard to sleep. Paradoxical insomnia is a fascinating one. This occurs where people will come in and swear they are only getting a couple hours of sleep a night, that they're not sleeping at all. You put them in a sleep study and they will come out and you ask them how many hours of sleep did you get? They'll say an hour, maybe 2 at the most. But then when you look at the sleep patterns, they got a full 7.5 or 8 hours of sleep. So they are actually getting a perfectly normal amount of sleep, but paradoxically they are experiencing it subjectively as only a few hours. And so that's a different disorder, probably having to do with your ability to maintain a sense of time while sleeping. Idiopathic insomnias is a generic label for insomnias that we do not know the cause of. And then inadequate sleep hygiene is, as we talked about before, if you're drinking caffeine, using your bed for a couch, all these things can disrupt your ability to sleep. We can contrast these with secondary insomnias, which are due to something else that is keeping you awake. This could be drug or substance related, such as, taking lots of caffeine or other uppers, right? If somebody has taken a lot of methamphetamine, they're not going to be able to sleep. But that's not a primary insomnia. That's a symptom of the consumption of the drug, so therefore we call it secondary. Insomnia is due to medical conditions, restless leg syndrome, pain, other, disruptions are secondary, and that falls into physiological insomnias as well. Like if you have severe back pain that's keeping you up at night, we don't need to treat the sleep, we need to treat the back pain, and the insomnia is a consequence of that. Outside of insomnias, another form of sleep disorder that is very common is breathing disorders. And the most common of that is what we call sleep apnea. This is where the back of the throat relaxes while you're sleeping and actually closes the airway, preventing oxygen from entering the lungs. As the oxygen levels in your blood drop, the brain freaks out and goes, oh my God, we can't breathe, and then it wakes us up, which causes the throat to open, we can start to breathe again, and then we fall back to sleep. People with sleep apnea may have dozens or hundreds of awakenings a night that they're not even conscious of. This can severely disrupt the quality of sleep, stresses the heart out, and makes people far more likely to have strokes and heart attacks. The most common treatment for sleep apnea is positive airflow, called a CPAP machine, which is a mask that covers the mouth and blows moisturized air into the nose to open up that airway. Many people struggle with the CPAP machines, particularly initially, and many will discontinue use of these machines, and therefore sleep apnea, while perfectly treatable, often struggles to get people to abide by the treatment. With time and with habit, most people can become comfortable with it, and many of the modern masks are much better than they were even a few years ago. Hypersomnias occur when people are unable to regulate sleep. Right? And this occurs when areas such as the raphe nucleus can become damaged, right? And it can occur with instead of being able to keep awake, the body tends to fall asleep, right? So this isn't insomnia, this is hypersomnia. And these are people who, when exposed to strong emotional triggers, laughter or anger, their physiological response is to suddenly fall asleep, right? It's an irresistible urge to fall asleep at inappropriate circumstances. Right? And this is a sort of an inability of the brain, particularly again in the raphe nucleus, to help regulate sleep. Regardless of why we wind up not getting enough sleep, whether it's lifestyle, whether it's insomnia, whether it's consumption of caffeine too close to bed, whether it's stress about money, school, work, or family, sleep deprivation is very harmful to the body. Sleep diminishes the brain function, it suppresses the immune system, it changes how we store fat, it increases the risk of high blood pressure and heart attack, it reduces our ability to form muscles, it can cause inflammation. The whole entire body breaks down due to lack of sleep. In fact, we can ask the question of how much do we even really need sleep? What happens if we just don't sleep? We force ourselves to be awake, we do something to keep ourselves awake. Most people will begin to experience what are called microsleeps. Microsleeps are where the brain literally drops down into deep sleep for split seconds, and then you wake up again. And these microsleeps will begin to increase in frequency and length until the person literally passes out into a full-blown sleep. These microsleeps can become deadly during travel. Right? We see them occur, for example, truck drivers who are doing long-haul truck driving who don't get proper sleep, force themselves to stay awake. They get a microsleep. It's one thing to be sitting on the couch, binge watching Netflix, and drop into a microsleep. That's another to be driving 90 miles per hour in a, 10-ton truck and drop into a microsleep, and that can end in deadly consequences. The point of this, though, ultimately is that the brain is so desperate for sleep, it will actually force us to sleep. We don't have a choice. No matter what we do, no matter what we try, unless there's something very wrong with our brains, our brain will eventually shut down. Even if we are just standing in a room, our brains will finally say, that's enough. We will pass out and we will sleep. So sleep is obviously doing something tremendously important to keep our cells functioning. In fact, we know just how important it is by looking at a small group of people who, due to a genetic disorder, lose the ability to actually have normal deep sleep. These people can have REM sleep, but they don't get any non-REM sleep. And this disease is called fatal familial insomnia. And the consequences of failing to sleep are right there in the title. This is a fatal disorder. As people lose the ability to sleep, they begin to have hallucinations, panic attacks, dementia, loss of memory. And once full lack of sleep sets in, they are usually dead within 6 months. So this tells us that whatever sleep is doing, right, it is literally keeping us alive. And that's why we do it. But how is it keeping us alive? Right? What is it doing? I think to explain that, or to see where that comes from, our best theories from it, we should take a look at parasomnias.